Hello and welcome everyone to our series on biostatistics and SPSS. Today's presentation is on experimental design. Now let's see what are the principles behind experimental design. The first is control. It means that you have two groups. One does not receive any interventional treatment or receives placebo. The second is randomization. It means that individuals in the group have equal likelihood of either receiving the treatment or the placebo. Next is replication. It means that you take a sufficiently large population so that the findings can be replicated again in another study in a similar population. Next is block. It means there are certain characteristics in the population which can affect your outcome, like age, sex, site, and comorbidities. So you want to make them equal, or you want to stratify your population so that it is equally divided in the two groups. So take for example of COVID-19, you have two groups, age, old and young. In old age group, the mortality is higher. So if you take a treatment group and you have more old patients there, your mortality will be higher in the treatment group. So you want to make it equalized so that you have equal number of old and young in both treatment as well as the placebo group. This is done by stratified randomization, which keeps these important blocks equal in both groups. So now that we know what are blocks, we need to know what are exploratory variables. These are those factors which are under our control, that is under the control of the researcher. Where block is the characteristics of the patient particular, exploratory variables is something which is control of the researcher. So exploratory variable, the example is something like a steroid. A steroid can affect the outcome in COVID-19. So it must be equal in both groups. So it basically means that all these type of interventions which are under the control of the researcher and which can affect the outcome must be again equal in both the groups. Now let's look into some of the important definitions. The first is placebo. Placebo is a fake treatment that is given in the control group, or it is either fake or no treatment. Placebo effect is when you see a positive response in the group despite receiving fake treatment. Now finally, coming to blinding, it means that the people involved are unaware of the group assignment, especially the people who are doing the research or the patient who is receiving the treatment, or it can also be the group who is interpreting the data. Thank you for your patience and check our website for further information.